over the throat or the floor of the oral cavity. And then as I asked you to clear away one side of it, mainly so we could see the muscles of mastication, the masseter and the temporalis. And so this one's not quite cleared away there yet, but you go from the corner of the jaw or the corner of the mouth up past the lateral corner of the eye, and there are some vessels deep to the skin that I want you to be sort of careful with, but you can take your scissors and cut right along the dermis. And when you get to the ear, continue this up here. When you get to the ear, you can just kind of pull the hide away and cut through the pinna, the external ear, and then continue that cut around. And then we're going to use that for blood vessels when we get up there, and a little bit of nerve stuff. But this will illustrate the two pretty large muscles. You want to be careful on the side of the cheek because there are ducts from salivary glands here. You can't really see it yet, but the biggest salivary gland, the parotid, which we'll see in a few weeks, is located just inferior to the ear, ventral to it. But the muscle that we see over the parietal here, this is all the temporalis muscle, which is going underneath the zygomatic arch, which is right here. It's going underneath the zygomatic arch to the coronoid process of the mandible. And then coming off of the zygomatic arch is this large cheek muscle, the masseter, and it's going down to the body and ramus of the mandible. So those are the two large muscles of mastication. The hypobranchial musculature we separate into pre-hyoid and post-hyoid. And so the hyoid arch is that U-shaped bone or assemblage of bones in the cat that runs right about where this vein cuts across. And so this is the hyoid venous arch, or venous hyoid arch, that runs across the throat. And the muscles coming up to the hyoid are post-hyoid muscles, and some of these muscles going cranially or anteriorly from the hyoid are the pre-hyoid muscles. The post-hyoid muscles are muscles that are coming from the manubrium, from the sternum, and going up to the hyoid ultimately. And so their names tell you where their attachments are. So the most ventral or medial, you can see right here, this is where the midline is, and on either side of the midline we have a small band that goes from the sternum up to the hyoid, and that's the sternohyoid muscles. And those run on the ventral surface of the larynx and the trachea. And so if you move those out of the way, you can see the voice box, the larynx right here. And then lateral to those are small muscles that do essentially the same thing, but they form a linkage up to the hyoid. And these from the sternum to the larynx is the sternothyroid. And then from the larynx up to the hyoid is a real small thyrohyoid right here. And so those also go from the sternum to the hyoid, but they have a linkage here at the thyroid cartilage of the larynx. And so collectively, these muscles will help stabilize the hyoid or depress it, pull it down, so that muscle activity up here in the prehyoid muscles changes depending on what you want to do. You can either raise your hyoid by contracting the prehyoid muscles, or depress the hyoid or stabilize it by contracting the post-hyoid muscles. and then you use one of the things with this linkage is you can elevate or depress the larynx. You can move the larynx up or down with the sternothyroid and thyrohyoid muscles. And you can use those to stabilize the hyoid when you're contracting these, and that'll cause contraction of these to move the jaw or move the tongue, etc. So those are the post-hyoid muscles. Pretty easy and easy to see. You might have problems finding them depending on where they did that surgery with the vessels to inject the latex in the vessels. And then on either side of those, you'll see the sternomastoid that we saw earlier. And so those are the V-shaped muscles that also come off the manubrium there and go up to the mastoid processes. Okay, on the pre-hyoid muscles, you want to clear away the hide right up to the jaw so that you can see the most peripheral of these. The first that you'll probably be able to see, and on some of your cats, you're going to have a lot of thick fascia, subcutaneous fascia over the floor of the oral cavity. But if you can separate these, you'll see one muscle has longitudinal fibers that insert onto the ventral rim of the mandible, or dentaries. And that muscle, you can't see it here yet, but it goes back to about the hyoid and then goes up to the base of the skull. This muscle right here. And this is the digastric. And it's called digastric because that means two bellies. And it has this belly that we can see superficially attaching to the mandible, and then it narrows to kind of a tendinous intersection, and that's attached to the hyoid by tendons. And then it forms another belly that goes dorsally or superiorly up to the base of the skull. So that can also be used to adjust the hyoid, or if the hyoid's stabilized, contracting the digastric or the digaster will open the mouth. It'll depress the mandible because it's attaching here. Now, if we move the digaster out of the way, and we'll see that again, we'll clear that up again a little later, you'll see a sheet of muscle that has fibers that run transversely. And it attaches to the mandible. And this sheet is the myelohyoid, which is used, it can pull kind of anteriorly on the hyoid, but it also elevates the floor of the oral cavity. So like when you're swallowing, you'll contract the myelohyoid to lift the tongue and lift the floor of the oral cavity. And underneath that are longitudinal muscles that are kind of a continuation of these the longitudinal post-hyoid muscles. And you have to be real careful when you're approaching those. We have to bisect the myelohyoid and peel it back carefully and expose those longitudinal muscles. And in order to do that, you want to cut through the myelohyoid, hold it up again as we've done with other sheet-like muscles, and cut through it off the midline, a little lateral to the midline. And so in this throat, you can see those longitudinal muscles forming kind of a bulge beneath the myelohyoid. And so we want to go just lateral to those and snip through the myelohyoid a little bit, and then just try to lift it up and continue that cut longitudinally toward the hyoid, and then turn around and continue that cut up toward the jaw. And then when we peel this back and clear away the deep fascia that's underneath it, we can see those longitudinal prehyoid muscles. And the most superficial one is right under the myelohyoid and is probably pretty tightly attached to the dorsal surface of the myelohyoid. And so if I peel back that medial edge of the cut I just made, there's a muscle here that runs from the chin down to the hyoid that's attached to the myelohyoid. And trying to tear it away from it probably will shred the myelohyoid. So you want to be as careful as you can be. And if I pull the myelohyoid back out of the way, you can see that muscle. That's going from the chin to the hyoid. It's called the geniohyoid. And we use genu as a root for chin on a lot of these muscles. So if it says genio, it's attaching to the chin. And then we clear away some of that fascia, and you want to be careful in here because there are some nerves and some blood vessels that we want to be careful with, that we'll want to see later. We'll see two muscles that are just lateral to the geniohyoid, and they're longitudinal also. This one that's kind of pink in this view is coming from the chin, and you can't really tell very easily yet because I haven't cleaned it away enough, but it's going, as it goes caudally, it goes dorsally to the base of the tongue. So that is Genioglossus. And glossus in this group, glossus is a root that says it's going to the tongue. And lateral to that is another similar muscle, but it is going from the hyoid anteriorly or rostrally in these guys and going deep to the tongue, to the base of the tongue. So that's Hyoglossus. And so those two muscles form kind of an X, pretty shallow X, but an X shape. Genioglossus is going dorsally as it goes caudally from the chin, and Hyoglossus is going dorsally as it's going anteriorly from the hyoid. And so those both insert onto the base of the tongue, and you can use Genioglossus to pull the base of the tongue forward. You can use Hyoglossus to pull the base of the tongue backward, and then that affects whatever they're doing with their tongue. And then lateral to the Hyoglossus and deep to it, and I haven't cleared that away yet on this, is a muscle that's coming up from the base of the skull and going to the base of the tongue. And that is the Styloglossus. So here, if you look in that little cavity, you can see the Styloglossus coming up from the styloid process on the base of the skull, and it goes to the base of the tongue also, and can help elevate the base of the tongue. It can help compress the pharynx because it runs along the side of the pharynx, and it pulls back or retracts the base of the tongue as well. So we've got Myelohyoid, the surface sheet, Geniohyoid right beneath that sheet, and then Genioglossus, Hyoglossus, and Styloglossus, and Digastric. And then once you can kind of see those, then you want to clean away a little bit so that you can expose more of those. And as I said, when we get to digestive and respiratory, we're going to open this up and we'll look at all the nerves that go through there as well. Okay, now 381 class also has a little tiny muscle that comes from the styloid process and goes up to the hyoid, and that's the stylohyoid. And we probably you want to be real careful as you're dissecting laterally around these muscles, because the stylohyoid is going to come up just inside or medial to the digastric, and it forms a little tiny strip of muscle that comes up to the hyoid. So we've really got to dig back, follow that digastric muscle back toward the mastoid to see that. And then one other you guys have, Lingualis Proprious. That's just that proprious means proper, and it means tongue proper. So those are the muscle fibers that make up the body of the tongue and cause the tongue to move around. Okay.